Welcome! Today, we'll be diving into two important branches of medicine, hematology and oncology. These areas focus on blood diseases and cancer, respectively. The goal of this presentation is to make these complex topics easier to understand. So whether you're just starting to learn about them or need a refresher, you'll have a solid grasp on the basics. Hematology is the study of blood, including its components such as red blood cells, white blood cells, platelets, and plasma, along with blood-related diseases. It also covers bone marrow, where blood cells are produced. Some key diseases in hematology include anemia, low red blood cells, leukemia, cancer of blood cells, lymphoma, cancer of lymphatic system, hemophilia, blood clotting disorder. Hematology helps us understand how blood works in our body and what goes wrong in blood-related disorders. Let's look at some common hematological disorders. Anemia, when you don't have enough red blood cells to carry oxygen to your tissues. Symptoms include fatigue and weakness. Leukemia, a cancer of the blood or bone marrow that leads to an abnormal increase in white blood cells. It affects the body's ability to fight infections. Lymphoma, a cancer of the lymphatic system. It can lead to swelling in lymph nodes and other symptoms like fever, weight loss, and night sweats. Hemophilia, a genetic disorder where the blood doesn't clot properly, leading to excessive bleeding from minor injuries. Oncology is the branch of medicine that focuses on the diagnosis, treatment, and prevention of cancer. Cancer occurs when abnormal cells begin to grow uncontrollably, leading to tumors or spreading to other parts of the body. There are many types of cancer, but we'll focus on the basics of how cancer works and the most common types. Cancers can be divided into several categories, but here are the most common. Carcinomas. These are cancers that start in the skin or tissues that line internal organs. For example, lung, breast, colon cancers. Sarcomas. Cancers that begin in bone, cartilage, or connective tissues. Leukemias. Cancers that affect the blood and bone marrow, as we discussed earlier. Lymphomas. Cancers of the lymphatic system, also mentioned earlier. Each cancer type behaves differently, which is why personalized treatment is so important. Although every cancer is different, there are some common symptoms to watch out for. Unexplained weight loss, persistent fatigue or weakness, pain or lumps that don't go away, unexplained bleeding or bruising, changes in bowel or urinary habits. If any of these symptoms persist, it's important to see a doctor for further testing and diagnosis. Diagnosing blood disorders and cancers typically involves blood tests to check for abnormal cell counts, such as red, white blood cells, or platelets. Imaging, X-rays, kinetic scans, MRIs, and PET scans can help detect tumors and check for metastasis, spread of cancer. Bone marrow biopsy, a procedure to check for diseases affecting the bone marrow, like leukemia. Biopsy, the removal of a small sample of tissue from a tumor to test for cancer cells. Treating blood disorders and cancer often involves a combination of approaches. Chemotherapy uses powerful drugs to kill cancer cells or stop their growth. Radiation therapy uses high-energy rays to target and destroy cancer cells. Immunotherapy, a treatment that helps your immune system fight cancer more effectively. Stem cell transplant replaces damaged bone marrow in diseases like leukemia. Targeted therapy, a treatment that targets specific genes or proteins in cancer cells to block their growth. The right treatment depends on the type of cancer or blood disorder, as well as the patient's overall health. Recent advances in hematology and oncology include personalized medicine, treatment tailored to the genetic profile of the patient and their disease. CAR T-cell therapy, a new immunotherapy where a patient's own immune cells are modified to target cancer cells. Liquid biopsies, a non-invasive way to detect cancer markers in the blood, allowing for earlier diagnosis and monitoring. While we can't prevent all blood disorders or cancers, there are steps you can take to lower your risk. Healthy diet. Eating a balanced diet rich in fruits, vegetables, and whole grains can help maintain overall health. Exercise. Regular physical activity can reduce the risk of some cancers, like breast and colon cancer. Avoid smoking and excessive alcohol. These are key risk factors for many cancers. Regular screenings, early detection through screenings like mammograms, colonoscopies, and blood tests can catch cancer before it spreads. In summary, Hematology is focused on blood diseases like anemia, leukemia, and lymphoma. Oncology is the study and treatment of cancer, which includes multiple types such as carcinomas, sarcomas, and leukemias. Diagnosis and treatment for these conditions involve a variety of tests and therapies. Advances in both fields are providing new hope through personalized medicine and innovative treatments. Remember, early detection and lifestyle choices can play a significant role in preventing and managing blood disorders and cancer.